Depression. Depression isn't just feeling sad. It's a mental disorder that slowly drains the color out of life. It affects how your brain uses chemicals like serotonin and dopamine, the ones that help you feel pleasure, motivation, and connection. When those chemicals aren't working properly, even simple things start to feel exhausting. You can sleep for hours and still wake up tired. Food doesn't taste good. Things you used to enjoy don't excite you anymore. Your mind keeps telling you that nothing will get better, and over time, you start believing it. That's because depression doesn't feel like sadness. Sadness has a reason. Depression feels like emptiness, heavy and constant, even when everything looks fine from the outside. People might say, just stay positive, or go for a walk. But depression isn't a bad mood you can snap out of. It's your brain struggling to do its job. Thoughts slow down. Decisions feel overwhelming.
Getting out of bed can feel like a huge effort. You pull away from people, not because you don't care, but because acting okay takes energy you don't have. And if it goes untreated, depression slowly changes how you see yourself and the world. It makes numbness feel normal and convinces you that hope was never real. Depression doesn't announce itself loudly. Most of the time, it's quiet, until you forget what feeling okay used to feel like.
Generalized anxiety disorder. Generalized anxiety disorder turns normal worry into a constant alarm that never shuts off. Your brain treats everyday situations like emergencies, even when there's no real danger. Everyone worries sometimes, but with anxiety disorder, the worrying never stops. You worry about things that haven't happened and probably won't. You lie awake imagining worst-case scenarios. You replay conversations over and over, convinced you said something wrong. One fear leads to another until your mind feels stuck in a loop. Your body feels it too. Your muscles stay tense. Your stomach hurts. Your heart races for no clear reason. You feel exhausted because your nervous system thinks it's protecting you all the time. Even small decisions become overwhelming. Sending a simple text turns into a mental battle. What if they misunderstand? What if they're upset? What if something goes wrong? Your brain struggles to tell the difference between real danger and imagined problems. People say, just relax, or stop overthinking. But anxiety doesn't work that way. Over time, the constant tension wears you down, and you start avoiding things just to feel some relief. And little by little, the world starts to feel smaller and more threatening. Attention Deficit Hyperactivity Disorder. Attention Deficit Hyperactivity Disorder, or ADHD, affects how your brain controls focus, impulses, and energy. You want to pay attention, finish tasks, and stay organized, but your brain doesn't always cooperate. ADHD doesn't mean you can't focus. You can actually hyper-focus on things you enjoy for hours. The problem is you can't choose what gets your attention. Boring tasks feel extremely hard to start, even when you know they're important. You may forget things, lose items, interrupt people, or act on impulse. Not because you don't care, but because your brain doesn't get enough dopamine to make follow-through feel rewarding. Time also feels unreliable, so deadlines often seem to appear out of nowhere. From the outside, it can look like laziness or lack of effort, but inside, you're usually trying much harder than people realize. ADHD creates a gap between knowing what to do and being able to do it. And willpower alone isn't enough to close it. Obsessive-compulsive disorder. Obsessive-compulsive disorder, or OCD, traps your mind in a constant loop of fear and relief. Your brain gets stuck on intrusive thoughts, unwanted ideas or images that feel scary, urgent, and impossible to ignore. These thoughts aren't things you want to think about, but they keep coming back anyway. To make the fear stop, your brain pushes you to perform certain actions called compulsions. You might wash your hands over and over, check locks repeatedly, count, tap, or repeat phrases in your head. These rituals bring brief relief, but it never lasts. The anxiety always comes back, stronger, demanding you do it again. OCD convinces you that your thoughts have power, that something terrible will happen unless you act just right. And even though you know the rituals don't make sense, the fear feels too intense to resist. This isn't about being neat or organized. Real OCD is exhausting and overwhelming. It doesn't make you.
Careful, it makes you a prisoner to thoughts you never chose to have. Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, happens when your brain stays stuck in survival mode after something deeply frightening. It can come from things like accidents, violence, abuse, war, or any moment where you felt your life was in danger. Normally, once danger passes, your brain calms down. With PTSD, that system doesn't switch off. The trauma keeps replaying, as if it's happening right now. Flashbacks aren't just memories, they feel real. A sound, smell, or sight can suddenly pull you back. Your heart races, your breathing changes, and for those moments, your body believes you're in danger again. Sleep is often disturbed by nightmares. You stay on edge, always alert, even in safe places. Loud noises make you jump. Crowds feel overwhelming. You avoid reminders of the trauma, which can slowly shrink your world. PTSD can also change how you feel. Emotions swing unexpectedly, or you may feel numb and disconnected from people you care about. It can make you feel broken, but it's not weakness. Your brain is trying to protect you. The problem is, the alarm never turns off. Bipolar disorder. Bipolar disorder causes extreme shifts in mood, energy, and thinking that a person can't control. It moves between two states, mania and depression, sometimes lasting days, weeks, or even months. During mania, you feel unusually energized and confident. You need very little sleep, your thoughts race, and ideas come non-stop. You may talk faster, take big risks, spend too much money, or feel like you can do anything. But the energy can become overwhelming, turning into irritability, poor judgment, or even losing touch with reality. Then comes the crash. The energy disappears, and depression takes over. Getting out of bed feels impossible. Things that once felt exciting now feel pointless. The contrast makes the low feel even heavier because you remember how high the high was. Bipolar disorder isn't just moodiness. The shifts are intense and unpredictable. It affects relationships, work, and daily life, leaving you constantly trying to manage swings your brain creates on its own. Panic disorder. Panic disorder causes sudden waves of intense fear that feel completely out of control. Your brain's alarm system misfires and triggers a full fight or flight response, even though there's no real danger. A panic attack can hit without warning. Your heart pounds, your chest tightens, and breathing feels hard. You may feel dizzy, numb, or shaky, and your mind becomes convinced something terrible is happening, like a heart attack or loss of control. The fear feeds the symptoms, and the symptoms feed the fear. The attack usually peaks within minutes and then fades, leaving you exhausted. But the real problem often comes after. You start worrying about having another attack. You avoid places where it happened before. That constant fear keeps your body on edge, making panic attacks more likely. Over time, your world can shrink. Panic disorder doesn't just make you afraid of situations, it makes you afraid of your own body, and whether it might turn against you without warning. Social anxiety disorder. Social anxiety disorder makes everyday social situations feel threatening, even when nothing bad is actually happening. Your brain treats being around people like a danger, triggering fear responses meant for real emergencies. Before speaking, your mind fills with worries. What if I say something wrong? What if they think I'm awkward? What if I embarrass myself? Your body reacts too. Your heart races, your hands shake, your voice comes out shaky or quiet. You're so focused on how you're being perceived that it becomes hard to think clearly or stay present in the conversation. Afterward, your brain replays everything you said, turning small moments into big mistakes. This isn't just being shy. Social anxiety makes avoidance feel safer than participation, even though you want connection. Over time, it can shrink your world and limit opportunities, not because you don't care, but because the fear feels unbearable. Eating disorders. Eating disorders change your relationship with food into something driven by fear and control. With anorexia, eating feels dangerous, and hunger feels like success. You may look in the mirror and see flaws that others don't, even when your body is already suffering. With bulimia, food becomes a cycle of eating and purging, followed by intense shame. The behavior promises relief, but it never lasts. Both disorders slowly damage the body, weakening the heart, bones, and organs. But the real struggle happens in the mind.
Eating disorders aren't about vanity or dieting. They're about control, perfectionism, and self-worth. The disorder convinces you that food is the enemy, and that letting go means losing control, even when holding on is causing harm. Borderline personality disorder. Borderline personality disorder affects how emotions are felt and regulated. Feelings that might be mild for others can feel overwhelming and intense.
A small trigger, like a delayed message or canceled plan, can cause extreme sadness, anger, or fear within seconds. There's often a deep fear of abandonment. You may cling to people for reassurance, then push them away when the fear becomes too strong. Relationships can feel unstable because emotions shift quickly, and people may seem either perfect or terrible, with little middle ground. Your sense of identity may also feel unclear. You might change how you see yourself depending on who you're with. This isn't manipulation or drama. It's an emotional system that reacts to everyday situations like crises, leaving you exhausted and desperate for stability.
Schizophrenia. Schizophrenia affects how the brain processes reality. You may experience hallucinations, like hearing voices or seeing things that aren't there. These experiences feel completely real, not imagined. You may also develop strong beliefs that don't match reality, such as feeling watched or targeted. At the same time, motivation and emotional expression can fade. Basic tasks like talking, showering, or focusing can become very difficult. Schizophrenia is often misunderstood. Most people with it are not dangerous. The real struggle is internal: confusion, fear, and not being able to trust your own thoughts or perceptions. With treatment, many people can manage symptoms, but stigma often makes the condition harder to live with. Dissociative identity disorder. Dissociative identity disorder develops as a response to severe childhood trauma. When experiences are too overwhelming, the brain protects itself by separating memories and emotions into different parts of identity. These parts may have different roles, emotions, or memories. Switching between them can cause memory gaps, changes in behavior, or feeling disconnected from yourself. This isn't pretending or having imaginary friends. It's a survival response. DID doesn't mean multiple people live in one body. It means one person learned to cope by dividing painful experiences. What once protected the mind can later make daily life confusing and exhausting, especially without understanding or support.